Good evening, everyone. I see people are joining us on Facebook and on the Zoom meeting. So I'm going to give a few minutes of chatter. I'm Dr. Jen Johnson, and I am here tonight for the IVAPM live session with Dr. Melina Zimmerman. And thank you so much for being here, Melina. Melina is a DVM and also an anesthesiologist and has a CVPP, is certified in acupuncture and rehabilitation, and she provides pain management and anesthesia consulting in the New Jersey, I guess the tri-state area. Melina?
Yep, I guess the tri-state area, yes, good. Yes.
And my old stomping grounds, but I'm so happy to have her talk about a topic that comes up so often, acupuncture in veterinary medicine and medical evidence for when and how we should use it. So I'm so excited for this, and thank you for being here. And if anybody has questions in the end, use the chat. We'll try to look at the one on Facebook as well. And this is being recorded, so if some of your colleagues haven't been able to join us live, we will have the recording available on the website and also on our Facebook group page for you guys to view in the future. But thank you, everyone, and thank you, Dr. Zimmerman.
Of course. Well, thank you very much, Dr. Johnson, for the lovely introduction. And, this is such an honor to be a part of IVAPM, and it's great to be able to provide this continuing education, via Facebook Live. So I hope that you guys enjoy this. Please feel free to ask questions. Dr. Johnson definitely has my contact information for anyone that has questions that don't get answered, or if you're watching this later and you come up with questions, please reach out. I'm very happy to chat about this. So just a little about me. Dr. Johnson did a very good job describing me. I am a veterinary anesthesiologist, so inherently I'm already a pain management specialist, but after getting my residency, I decided to go ahead and get my CVPP certification through IVAPM just to further, expand my knowledge of pain management and be able to help educate and support other veterinarians, students, and other veterinary professionals in pain management endeavors. Acupuncture was something that I never thought I would get into. However, after my residency, when I got into clinical practice, the acupuncture certification just came to me, that it was an opportunity I was able to pursue. So I pursued my acupuncture certification through Curacor in Colorado. So technically, took the medical acupuncture side, but tonight, as we'll describe, acupuncture can be a traditional Western medicine, traditional Eastern medicine, or a combination kind of the two. And we'll get into that a little bit more as we move through acupuncture. But just starting in general, when we think about pain management in veterinary medicine, this is a really diverse field. There's so many different indications for when we use pain management in vet med, and there's so many therapeutic modalities that we can use to, get that pain management going for our patients. Scientific evidence is definitely going to lack for a lot of the clinically relevant pain management options and techniques that we have. So, this is really because we have low case numbers. Some of the modalities are newer, or we're using modalities from human medicine and applying them to veterinary medicine. So again, we a lot of the times use anecdotal evidence, as well as a physiologic and pharmacologic knowledge, and then take that knowledge and that anecdotal evidence and create pain management protocols. But as we'll talk about later in this talk, we really help that knowledge to create scientific studies that are going to help to give us the evidence that we need to know that the pain management that we're doing is actually really good pain management, and the right thing to do for our patients. So how do we treat pain in veterinary medicine? So remember, analgesia is going to be defined as the absence of pain. The pain pathophysiology of each individual patient is going to be very unique, meaning that their treatment options, depending on how they're exhibiting that pain, might vary. So meaning for a cat that's getting, an ovariohysterectomy, they might need a 5-day course of an NSAID post-operatively, or if we decide to do, different types of analgesia preemptively, we might not need as long as a post-op course of pain management. So depending on whether we're dealing with that acute pain, or as we'll get into in this talk, more chronic pain management, and the physiologic response of that patient, we're going to choose different treatment modalities. So we have pharmacologic and non-pharmacologic approaches to pain management. The pharmacologic approaches are not something we're going to jump into in this talk, but this is things such as injectable analgesics, oral analgesics, supplements and nutraceuticals, joint injections, epidurals. When we think about non-pharmacologic approaches, this is where we get into things like acupuncture, diet, weight control, environmental modification, maintaining activity and mobility in our patients. Maintaining nails in our patients can be extremely pain relieving for some of them. Physical assist devices, rehab and physical therapy, nerve stimulation, laser, ultrasound, shockwave therapy, and some surgical procedures are actually analgesic in and of themselves. The scope of this talk is going to be about acupuncture, but I bring up all of these other things because as we get into the clinical studies that we're going to see later in the talk, it's important to remember that a combination of all of these different modalities is usually going to be the most appropriate thing to give our patients more of a multimodal approach to analgesia. So getting into veterinary acupuncture, this is going to be whether you are applying this as medical acupuncture, traditional Chinese acupuncture, it's all adapted from traditional Chinese medicine, which has been practiced on both humans and animals for over 2,000 years. So veterinary acupuncture is going to employ a current knowledge of anatomy, physiology, as well as pathology. And the whole point of what we're doing is manipulating the central nervous system to create what we call neuromodulation. And that's to get a desired response, which typically is going to be pain relief, or as we'll see, veterinary acupuncture can have some other, therapeutic endpoints as well. The way acupuncture works is we use fine sterile needles, like the ones that you see in this bottom right-hand corner, and we place them in specific acupuncture points or acupoints to provide stimulation and create these physiologic effects. So when we think about specific acupuncture points, this is a drawing of all of the acupuncture points throughout the dog. This has been adapted from a human application, but interestingly, Chinese medicine actually utilized acupuncture on dogs as some of the first examples of acupuncture that they used. So this idea of all of these acupuncture points in the dog are specific anatomical locations, and they're made up of a degree of neurovascular bundles consisting of free nerve endings, lymphatics, vessels, as well as other cells in these areas. The way that these acupuncture points are connected throughout the body are connected in meridians or groups of points. So you can see on this dog up top here, the lines that are being drawn are actually in the meridians of all of those points that are being connected throughout the body. And depending on how you look at it, those meridians or groups are associated with actual nerve pathways, as well as vascular roots, lymphatics, and other areas of modulation throughout the entire body. The way that we identify acupuncture points are going to be by type. So there's 4 main types of acupuncture points. The first type of acupuncture points are going to be located within motor points where a major nerve is going to enter a muscle. These type of acupuncture points make up about 70% of the acupuncture points that we use in veterinary medicine. And so definitely the most common when it comes to acupuncture points. Type 2 points are going to be where superficial nerves are going to intersect on the dorsal or ventral midlines of the body. Type 3 are going to be located at points of convergence of superficial nerves or some sort of nerve plexus where a lot of nerves are kind of coming together all as one. Type 4 acupuncture points are going to be located where nerves are actually penetrating into tendons. So depending on what you're trying to achieve with your acupuncture, you're going to choose a variety of different types of acupuncture points. When we think about now stimulating these acupuncture points, so once you decide on your treatment, you decide on the application of your treatment, now we have to say there's lots of different ways we actually can stimulate these points to get a desired effect in our patients. One of the most easiest ways to perform acupuncture is through what we call dry needling. This is as simple as placing the needles into the tissues, the desired acupuncture points, activating those needles. And, the idea is that just that dry needling is going to get you the achieved desired endpoint of that acupuncture treatment. Some patients who are phobic to needles, they're not tolerant of needles. I know we all have those patients that, to think about doing acupuncture on them puts a smile on your face just because you know that you're not going to get near them with, a 10-foot pole when it comes to needles. A lot of those patients will become sensitized over time. However, things like acupressure, so just doing massage therapy or simple, compressive therapy over acupuncture points can be therapeutic. Electrical stimulation or electroacupuncture is something that can be used on top of dry needling and can help to further accentuate the treatment that you're getting and potentially activate different types of nociceptors or different types of therapeutic endpoints depending on the type of stimulation that you're using, meaning the frequency of stimulation. There could be a low frequency of stimulation or a higher frequency of stimulation depending on what you're trying to achieve. And we'll talk about that a little bit when we get into some of the studies later in the talk. Injections or aquapuncture is something that can be incorporated in, and some people use things simple as water, or you can use things such as B vitamins or other medications. That's something that hasn't had a lot of evidence in veterinary medicine, but in traditional Chinese medicine is a much more common thing that's done. Another common thing in traditional Chinese medicine is this moxibustion or heat, which you can see this dog down here is getting applied to the acupuncture needles that are in. So after the dry needling is done, the heat is actually applied to the needles, sometimes with some, herbal type of stimulation to create a more desired effect as well. And just like some patients are needle phobic and acupressure might be a little more appetizing to them, laser stimulation of acupuncture points has become a much more talked about thing in veterinary medicine. And there actually are some studies that we'll talk about later that look at laser stimulation versus traditional dry needling versus electroacupuncture, and found that laser stimulation can provide, a very good endpoint for acupuncture administration in vet med. What do we get when we actually talk about the effects of acupuncture? So when we stimulate these acupoints, we're going to activate neural as well as neuroactive components in the skin, the surrounding tissues, as well as the muscle. And all of this is going to create a physiologic change that can modulate the entire pathway via local or peripheral mechanisms. Then we'll get into talking about spinal mechanisms of acupuncture. And then we'll talk about supraspinal or the actual brain effects that acupuncture is going to create. Before we do that, let's just quickly review the pain pathophysiology. This pain pathway here, I'm sure is familiar to mostly all of you. So typically a pain pathway is going to start with some sort of noxious stimuli that's going to, create either a mechanical, chemical, or thermal response, depending on the type of receptor it's going to activate within the periphery or local tissue. That's going to create a transduction or a chemical signal that then is transmitted up axons of nerves to the dorsal horn of the spinal cord. And that's going to be where modulation is going to occur. This is where the spinal cord is going to create changes within cells, within transmitters, and actually modulate itself to then project the pain signal up to the brain, where then, in various parts of the brain, depending on where the signal is coming from, a perception happens and then pathways that go back down, and you see that pain response happen. So when we think about, how we actually stop this pain response now and how acupuncture is going to work, it's important to kind of take it from the step of the pain pathway and move forward from there. So when we think about the local or peripheral effects of acupuncture, this is now going to be at that skin level where all of those nociceptors are in the periphery. So as the needle is inserted and twisted into place, several local reactions or effects begin to occur. Initially, we're going to get a myofascial release of that muscle tissue wherever we're putting it. This can lead to a significant reduction in trigger points, as well as any kind of hypoxic damage within the muscle is going to start to be improved. There's going to be local anti-inflammatories as well as local anti-nociceptive effects that we see from acupuncture administration, as well as activation of those sensory afferent nerve fibers, so the nerve fibers from the periphery that are going up to the spinal cord, and that's via transmission of those nerve fibers up to the dorsal horn. This little drawing down here is just a nice example of that we put a needle in and there's really nothing going on a skin level, but under the skin level here, you can see that there are, cells and tissues that are going to start to be affected by those needles being placed under the skin. Specifically, when we think about this and we think about what actually happens when that needle is placed under the skin, the actual cells that are going to be affected are going to be fibroblasts, mast cells, and other local cells that are going to then release vasoactive substances and neuropeptides into that local tissue. Some of those vasoactive substances and neuropeptides include ATP, CGRP, substance P, NGF, and there's many, many others. All of those vasoactive substances and neuropeptides are actually going to create a vasodilatory effect that then is going to bring in immune modulating cells such as macrophages, T cells, lymphocytes. Those are all going to lead to anti-nociceptive effects as well as anti-inflammatory effects in the local peripheral tissue. This also is going to lead to a significant increase in endogenous opioids, which we know are a very large component to the peripheral mechanisms or the local mechanisms of acupuncture. The other thing that we see locally is an increase in CB2 receptors, and this is going to further increase the release of endogenous opioids, which, like I said, is a very important component. This altogether is going to decrease COX-2 and prostaglandin production within the peripheral tissues. So again, it's going to reduce nociception and decrease inflammation. It's also going to act on peripheral opioid receptors to desensitize peripheral nociceptors on the sensory nerves within the peripheral tissue. So this actually creates, interestingly, a local analgesic effect as well as an anti-nociceptive effect of the endogenous opioids. So now we take that receptor, so we've placed the needle into the skin, we've activated all of those cells within the peripheral tissue. Those cells have created a sensory response that then is going to be transmitted up to the dorsal horn of the spinal cord, where more endogenous opioids, other substances such as norepinephrine, serotonin, dopamine, as well as other neurotransmitters are all going to be released within the dorsal horn of the spinal cord. Overall, this release of neurotransmitters and endogenous opioids is going to lead to a decrease in the pain signal by downregulating and decreasing the activity of pain receptors within the dorsal horn, as well as stimulating descending inhibitory pathways via projection up to the brain, and then, that downward projection of descending inhibitory pathways. So at the spine, again, getting a little bit more specific into what actually is happening and in the dorsal horn of the spinal cord, we get a downregulation of glutamate release, and we get a dampening of all of the glutamate receptor activity. So the most notable glutamate receptor activity that we get a downregulation in from acupuncture is going to be the NMDA receptor. Other things that we see are inhibition of spinal glial cell activation. This is going to lead to a decreased production of pro-inflammatory cytokines. We also see an enhancement of GABA, which is an inhibitory neurotransmitter, as well as a decrease in production of excitatory neurotransmitters such as substance P, CGRP, and other things that are going to continue to activate those pain receptors. So overall, within the dorsal horn of the spinal cord, we're getting a decrease in pain response, as well as decreasing that wind-up pain that we think about when we think about chronic pain and chronic activity of these glutamate receptors within the dorsal horn of the spinal cord. Moving up to the brain, there are many nuclei within the brain that are going to be involved in acupuncture analgesia. The opioid peptides and their receptors are probably one of the more important receptors that are responsible for some of these brain mechanisms of analgesia. And these are going to be located throughout the cerebral cortex, the hypothalamus, the PAG, gray matter, within the pons, and the medulla. Those are all pivotal for the spinal, the supraspinal mechanisms of acupuncture analgesia. The overall guiding principle of the brain when it comes to acupuncture is that stimulation from the actual needling is going to lead to an activation of various descending inhibitory pathways and pain modulating pathways for these anti-nociceptive responses. So depending on whether we're talking about visceral analgesia, peripheral analgesia, wherever we're talking about the analgesia is going to determine what nuclei we're talking about in what area of the brain. One thing that we talk about a lot in pain management is going to be neuroplasticity. So when we think about chronic pain, we think about a negative neuroplasticity where the brain and the spinal cord actually change to conform to the pain response that our patients are having. So when we have these patients with chronic pain states, their actual genetic makeup of their brain and spinal cord and the cellular makeup has completely changed. We've actually seen in many studies now that acupuncture has a positive effect on neuroplasticity as well as giving neuroprotection. So meaning when we have patients that receive chronic acupuncture, this actually can lead to a potential reverse in the neuroplastic changes that we see from chronic pain, as well as protecting the brain and the spinal cord from getting those changes in the future when we're dealing with these ongoing chronic pain stages. So getting into more of the clinical use of acupuncture in veterinary medicine, there really are many applications for clinical use. We usually use it for things like pain relief, but anytime we need improved circulation or anytime there's any sort of tissue or organ dysfunction, acupuncture is a potential beneficial, try to do. The main reason we say that is because overall acupuncture is very safe when done by trained professionals, and it is specific to veterinarians. There's very few contraindications when it comes to acupuncture. Tumors are going to be a contraindication, but meaning we only want to avoid needling directly around or in a tumor. So if a patient has an osteosarcoma on its hind leg, it can still get an acupuncture treatment, just avoiding the actual tumor area. Open fractures, pregnancy, again, very similar to tumors, fractures and pregnancy, we just want to avoid the actual area, the gravid uterus, or the area of fracture. Patients with coagulopathies and neutropenias, it has to be at your discretion, meaning, if a patient has a coagulopathy, it's usually a no-go for acupuncture, but neutropenias, especially with patients getting chemotherapies, is something that we need to weigh the pros and cons of the treatment and the level of neutropenia. So that's definitely at your discretion. How do we actually use acupuncture and what can we use it for? So like I said, we think about it more for acute or chronic pain, but when we have patients with degenerative joint disease, osteoarthritis, intervertebral disc disease, neck and back pain, any kind of orthopedic injury, neurologic injury, moving on to other types of organ dysfunction, so gastrointestinal issues, anorexia, inappetence are something that I very commonly use acupuncture for. Allergies, urinary and fecal incontinence, wound healing, immune dysfunction, overall well-being, and there's many more applications of acupuncture. These are probably just more of the common ones in veterinary medicine. So when we get into the actual scientific evidence, all of the work that I described as far as the peripheral, spinal, and the supraspinal mechanisms of acupuncture have all been thoroughly documented in both human and veterinary medicine to show that these are actually the effects and the mechanisms of actions that we're getting from using acupuncture. When it comes to actually using it for pain management, though, this is where, we kind of run into a little bit of a backup as far as evidence goes. Now, in human medicine, we do have some very large, very good studies showing the benefit of acupuncture. And in 2018, Vickers et al. Performed a meta-analysis, which is just a big conglomerate of lots of different studies looking at acupuncture for pain management in people. They were actually looking at it for chronic pain, and it showed, in many very large numbered studies, the positive effect, overall of acupuncture for chronic pain management in humans. Now, retrospective and prospective studies are starting to accumulate to support some positive clinical benefit in acupuncture in veterinary patients, but a lot of the times this is really limited by small study numbers and just lack of, kind of clinical application over a wider period of patients. So I'm not going to get into too many studies when it comes to, some of the applications of acupuncture, but these are just some good highlights of studies showing that this is a wide variety that we're using it for, and acupuncture is being looked at in veterinary medicine in a post or preoperative setting. And applying acupuncture in patients prior to or post-operatively has actually been shown in many many veterinary studies to be just as effective as using, pharmacological intervention. So again, in my opinion, it's not an all or nothing type of thing. It's really that we can use this in combination with our other medications, with other treatments, to get kind of this multimodal approach to pain management. So like I said, in cats, especially, laser therapy might be something that is better tolerated, but this study had looked at the efficacy of laser acupuncture. So just applying acupuncture with a therapeutic class 4 laser at specific acupressure points. They compared that to electroacupuncture in cats that were undergoing ovariohysterectomy. They also received analgesia and they received rescue analgesia, and they really found that there wasn't a big difference between laser and electroacupuncture, and they were both beneficial in providing analgesia to our patients. The bottom two studies are two studies that looked at electroacupuncture actually versus a pain medication in dogs that were going through ovariohysterectomies, and found that both acupuncture and the medications both provided adequate levels of analgesia for those patients. One area where acupuncture has been more thoroughly investigated in veterinary medicine is with neurologic disease. So the next couple studies that we're going to look at are actually evaluating acupuncture versus traditional either medical or surgical intervention with dogs with intervertebral disc disease. So this was a study done in 2007 by a group out of Brazil, and they were evaluating electroacupuncture treatment for thoracolumbar intervertebral disc disease in dogs, using a combination of electroacupuncture and Western medical treatment, which just entailed the patients getting steroid therapy. And they found that all of the dogs, so this was in 50 client-owned dogs. So in the dogs, a combination of that electroacupuncture and the steroid therapy compared to steroid therapy alone resulted in a shorter time to recovery to ambulation, as well as deep pain perception in these dogs. So in the bottom here, this is just an example that in the two different groups, there was a significant time period between, in group 1, these are the dogs that were just receiving Western therapy alone, and in group 2, these are the dogs that were receiving electroacupuncture as well as steroid therapy, and they all had a significant decrease in their time to ambulation, some of them by over a week, some of them over 2 weeks, which was pretty cool. Another study that recently came out, this is a study that was looking at the non-surgical rehabilitation in dachshunds with a T3L3 myelopathy, and looking at prognosis and the rate of recurrence. Overall, and I'm sorry, this is kind of covered up here, but they were comparing decompressive surgery, electroacupuncture, as well as just decompressive surgery alone. They found that dogs that received electroacupuncture with their decompressive surgery had a much greater incidence of returning to full function after, having this T3L3 myelopathy. This last study that we'll look at here is a little bit of an older study, but again, it's comparing decompressive surgery, electroacupuncture, with dogs with intervertebral disc disease. And this was 40 dogs that had TL that was a little more long-standing, so over a week of duration. And they found that electroacupuncture was more effective than surgery for ambulation and improvement of those neurologic deficits in these dogs. So I'm sorry that those studies were cut a little short. I don't know why my thing cut short there, but talking about acupuncture in veterinary medicine, this is going to employ a knowledge of anatomy, physiology, and pathology. We know these things, and we know how to manipulate the central nervous system to create this neuromodulation and provide the desired response that we're trying to get in our patients. We have shown that acupuncture is potent in anti-nociceptive activity in acute and chronic pain models in both human and veterinary medicine. But we do know that despite the studies that we briefly looked at tonight, we do need more studies in veterinary medicine. So, the title of this lecture should be, evidence-based ? But we're working on that evidence-based, and the more evidence that comes out, the more positive effect of acupuncture we see in veterinary medicine. So, if you're motivated tonight, definitely look into clinical application, clinical trials and studies that can be done. Looking at cohort studies are always going to be the best, but anything we can put out there, repeating studies are always going to be beneficial. I'm happy to take any questions. I know that was a bit short, but I appreciate you guys being here, and we can definitely talk about those studies in a little more detail, or take any questions, if you guys have any tonight.
Thank you, Dr. Zimmerman. I think you did an amazing job really being concise about what we really have that is available in veterinary medicine. I just had one question. Do you have any feeling about using acupuncture for behavioral disease? I know in humans, they looked at this a bit, but with animals in veterinary medicine, do you have any comments about that?
Yeah, I think acupuncture for behavioral medicine is something that definitely warrants some good research in veterinary medicine. However, clinically, I have used acupuncture for many types of behavioral type of issues. I think probably one of the best applications for it is with anxiety, and in people, they really show in studies that is a significant desired effect of acupuncture is this anti-anxiety effect. If we think about pain pathophysiology and we think about all of the receptors and neurotransmitters that are released during a pain response, they're very similar to those that are released during anxiety or stressful responses from patients. So when we think about how acupuncture can decrease nociceptive activity, we can then parallel that to this anti-anxiety effect or anti-stress effect of those patients. One of the studies that I showed you actually looked at cortisol levels in patients and showed that it did significantly decrease. So I definitely think that if we had a study looking at this a little bit more, we would see the benefit of acupuncture for anxiety specifically. But I think for most behavioral things, acupuncture is definitely something that is warranted, and I've clinically used it many times.
Yeah, and one of the comments from Facebook, Dr. Robinson has been following along, and thank you, Narda, very much. But and we always go back and forth about this when we talk about behavior and the combination of pain plus behavior, and if the perceived behavioral problem is because of pain, where it's going to be very difficult to determine, is the acupuncture really helping the pain and then helping the behavior or something like that,
Yeah, and chicken before the egg in that sense, not really a big deal. I have to say, in some of the patients that I've seen these really positive anti-anxiety effects, some of them we were treating for their anxiety, some of them we were treating for something completely different, and we just saw this, very beneficial effect from the acupuncture, and, they noticed the difference at home, and, I hear that very commonly. And Dr. Robinson is my instructor for the CuraCore acupuncture course that I took, and I'm actually in the middle of taking the advanced acupuncture course, and we're talking about all of this type of stuff and these questions, looking at the evidence, looking at how that's all affected, especially from a brain perspective, but also from these spinal mechanisms, as well as peripheral mechanisms that are creating all of these changes. And I really think that neuroplasticity, piece that I talked about briefly is just so interesting, that we can actually use acupuncture to take these chronic changes that were made to the brain and the spinal cord, and we can actually create not only changes, but protection for them in the future.
awesome stuff.
Yeah.
Really is. Well, I know everybody appreciates this review. This, you gave us a lot of information in this time. And I know if there are any other questions, please reach out to IVAPM and we can get your questions answered by Dr. Zimmerman. And I appreciate everybody who's on Facebook and also on Zoom being attentive and learning more about acupuncture and pain management. And thank you so much, Dr. Zimmerman. And we'll see you guys all soon. Take care.
Thank you so much. Take care.
Bye-bye.